Okay, so the second assessment that I drew was the visual analog pain scale. The visual analog pain scale is a scale that is used to measure the intensity of pain that is experienced by an individual. So this particular assessment is extremely easy to administer. There will be a 10 centimeter line. On the left side of the line is indications of no pain at all, whereas on the far right of the line, this would indicate the worst pain ever experienced. Underneath this line, there is a set of faces. On the left side of the set of faces, you'll have a smiley face, which is representative of no pain at all. Whereas on the right side, there will be a face with a frowny, which would indicate the worst pain ever experienced. This test is used to assess the function of the nervous system, specifically the sympathetic nervous system, which controls an individual's intensity of pain. This is a standardized assessment, meaning that each person who completes this assessment completes it the same way, and then it will be scored the same way as well. This assessment is done on paper. The client will use a pencil and mark on the line where they feel that they experience their pain, or where they would consider their pain level to be. And then the different groups that this can be administered to would be those with rheumatic diseases, those recovering post-surgery, individuals with burn pain, or elderly patients who might have pain from just age-associated wear and tear. It will be important for those kind of clients to explain exactly what it is that they are assessing on this scale, because they might become confused, especially for individuals with dementia or anything like that. Once the client has completed the assessment and marked where they would assess their pain level to be, the therapist can then take that mark. They'll use a ruler to measure on the line where it is specifically that the client rates their pain. So a pain level from 0 to 4 millimeters indicates no pain at all. 5 to 44 millimeters would indicate moderate pain. 45 to 74 millimeters would indicate moderate pain, and then 75 to 100 millimeters measured on that line would indicate severe pain. This test can be used to assess an increase in pain over time for those with chronic pain. And once the assessment is completed, it will be important to ensure levels of, and as well as the location of pain, to the interdisciplinary team to prevent severe discomfort during any sort of therapeutic treatment. For example, if a client experiences a knee replacement, the VAS can be used to determine the level of pain that they experience in that specific joint. It will be important to relay this information to physical therapy in order to prevent any overexertion or extreme discomfort when working on any exercises that are focused on that impacted joint. So a note to the interdisciplinary team that the OT may write would be: the client recorded that their pain level is at 79 millimeters from the starting line on the VAS, which indicates a severe pain level following a knee replacement. Physical therapy should refrain from extensive treatment to the joint until the client scores below at least a 75, indicating a level of moderate pain.